Hi, I am Dr. Ashish Davalbhakta at Aesthetics Medispa and Advanced Aesthetics in Pune. Today we are going to cover rhinoplasty. Rhinoplasty is a Latin word for noseplasty or nose shape improvement. It's a aesthetic plastic surgical procedure where we work towards improving the shape of the nose. That's what rhinoplasty actually means. Now, rhinoplasty is a procedure that is very popular, is very commonly performed by aesthetic plastic surgeons, and it has a lot of indications. You may want to do rhinoplasty or change the shape of the nose for broad nose, or it could be a crooked or deviated nose. It could be one where the nose doesn't have adequate projection, a saddle nose, or tip lacking projection. So there are many indications, and these indications vary from person to person. So that is why it's very important that you have an analysis done before deciding on what type of rhinoplasty should be done. So if you have any concerns, if you feel that your nose doesn't look good, it is wise to at least come forward and have a consultation with an aesthetic plastic surgeon here at Aesthetics Medispa and voice your concerns. We will hear them out, we'll take photographs, we'll load them up in a software where we use morphing, and then we plan what improvements are possible. Almost all improvements are possible in a rhinoplasty, but it's very important that we understand what you desire and what is possible, and getting both of those to meet is very vital. Your desire and what we can achieve. And that is why we do morphing, to actually show what kind of an improvement is possible. We can get anywhere between 70 to 120% of what we are showing you, and that will then give you a reassurance of what to expect. Now, this procedure is done as a day surgery in Aesthetics Medispa, and a lot of cases require cartilage as an augmentation or as support when we change the shape of the nose. And we harvest this either from your septum or from your ear or from the rib. So again, the complexity of the procedure varies depending upon what components of improvement are needed. You could have a very simple requirement where we have to only narrow your nose. Okay, everything else is okay, but you feel that your nose is broad. Then you can have the bones of your nose and the alar base narrowed, which is called a narrowing osteotomy and a rhinoplasty. And with just those two components having been addressed, you can get the result that you want. But often the tip projection has to be improved. Often the dorsum or the middle third of your nose needs to be made sharper, more defined. In that case, you need augmentation, where we use these cartilage materials from either the septum, which is that part of the cartilage which separates one nostril from the other. It's in the same area of the operative field, or from the ear, which is called the concha. So we can take it from the concha, from behind, without actually leaving any scar. And the third option usually that we prefer here is rib cartilage. There are some surgeons who would use foreign materials like implants and place those silicone implants or polypropylene, polyethylene implants in the nose. They have a higher risk of extrusion or infections, and long term there are more complications with those kind of implants, and hence we prefer to use autologous or something from your own body, so that it gets nicely incorporated in your body, becomes part of you, and is a lifelong kind of a correction. The result that you get from a rhinoplasty is permanent. There is usually a 6 to 8 weeks, or sometimes even up to 12 weeks of healing time, where swelling takes time to go away. Once the swelling goes away, your nose looks sharp, and I'm sure you would be happy with that kind of a nose. So if you have any concerns, if you feel that your nose could look better, come forward and have a consultation. Don't hesitate to give us a call, and we'd be happy to sit with you and go through a detailed consultation to understand your concerns and to explain to you what is possible. how easy or how difficult that is, but I don't see any reason why you should hesitate or just live with the kind of nose that you have, because in this modern day and age, everything is possible, and there are so many patients of ours who are now so happy with the improvement they've had, and it is a life-changing experience. So I hope you like this little educational video. If you have liked it, please click on the like, share or comment section, and subscribe to our channel. Thank you very much.